Namaskar, parents. Parents, today we'll be talking about virtual autism. What is it? How is it different from the autism spectrum disorder? Whether it is different from that? What exactly it is? See, firstly, what is autism? When do we diagnose a child to be on the autism spectrum or autism is when there is delay in the child's social and language milestones. The child is not social, the child does not give eye contact, you call the child, they do not respond, they are busy with their own type of play or own type of stimulation, their speech is delayed, or even if it is there, it is very limited or maybe just need based in a word or two, or else they communicate only non-verbally by leading, they do not point, they do not have joint attention, they have repetitive behaviors, self-stimulating repetitive behaviors which we call as stereotypic repetitive movements like hand flapping or toe walking or putting things in the mouth or going round and round in circles or looking at fans or tires or their fingers. So different sorts of stimming behaviors. If you see this in a child, and because of this there is a significant developmental delay, the milestones are not as per the age, that is when we say that the child has autism, right? And virtual autism is when the child has these symptoms plus the child has a history of screen exposure for at least 4 hours a day. We do not call it virtual autism. Virtual autism is a term which was coined post-COVID, right? Virtual means excessive screen exposure. So this, during COVID, children had a lot of screen exposures, following which a lot of developmental delays, speech delays, hyperactivity, autism-like symptoms were seen in them, right? And in some children it was seen that when that screen exposure was stopped and the child was aggressively stimulated through therapies or with their parents, when the parents put in a lot of effort, they put them for therapies, there was a lot of aggressive stimulation to the child, then within a few months, some children totally bounced back. They quickly attained their delayed milestones. There was a sudden change in them. For these children, this term virtual autism was used, right? So parents, this is basically a term that has been used post-COVID. It is not a diagnostic term. When we are in training, when we are students, we never have seen this word in any of our diagnostics manuals. This is a very new term which has been coined, and this is used depending on the outcome of the child. That when you stopped screen and you started stimulation, did the child revert back quickly? The problems that were existing, how quickly were they solved? Usually within 3 to 6 months, you see a drastic improvement in these children. Then you can say that, okay, this was virtual autism, right? But such children make up only 10 to 12%. The rest have autism spectrum disorder, which is a neurodevelopmental delay. And it means that as the child grows, the age progresses, a new set of developmental issues will be seen. What you are seeing today that may either progress or a new set of symptoms or new set of issues you may see. That is the spectrum, right? So parents, see, I am making this video only to tell the parents that parents are coming to me and arguing that no, you tell us whether our children is classic autism or their virtual autism. As a parent, how does it matter? How does it matter to you whether the child has virtual or whether the child is classic? It shouldn't. What should matter to you is that there are certain delays that I notice in my child. When I compare my child to another child of the same age, I see that there is a difference in these milestones. There is a delay. That is why you come and seek help now, or you seek a consultation from a specialist. So you can see that there is a delay, accept it, and start working on it. As parents, that is what concerns you. The diagnosis is of importance to clinicians, to us, not to a parent. A parent will always wish that as fast as possible I should get my child back on track, and that is the only thing that should matter. Diagnosis is not your concern. That label is not your concern. Why you want to label the child? Right? If you feel that there is an issue, seek consultation, start the required intervention, therapies at a center, therapies at home, aggressive intervention, and aim to bring your child back on track as quickly as possible. That is what you should aim at. That is what a parent needs to aim at, right? So the term should not be of any importance to you, okay? And just identify and work with your child. Work with the conviction that yes, if I will work with my child, I will put in some amount of patient and happy hours with my child. I will intervene, I will interact. My child will progress. Work with this conviction and you will see very, very positive results. Right, parents? So please do not run after diagnosis. I have seen parents consulting not one but multiple specialists, 4, 5, 6 specialists, just to somehow hear from them what they want to hear. No, shouldn't. Don't go to any specialist. As far as I am concerned, a parent can identify that there is an issue. Start intervening. That is important. As early, as aggressive as possible. That is important. Right, parents? So, virtual autism is basically just a term, and this term is used depending on the outcome of the therapies. If the child has reverted back within 3 to 6 months of stopping screen and starting therapies and intervention, you can say that yes, the child had virtual autism. That is it. What needs to be done is the same. Aggressive intervention, OT, if the child has sensory issues, sensory integration, speech and language, all 3 need to be worked on. Right, parents? So don't get diverted by these things. Set your priorities, work on your child, give them your 100%, and rest you leave on God. Yeah. So do share this video, like it, subscribe to our channel, and let the Shakti spread. Vijay Bhava, Tatha Astu, Namaskar.